We're going to go through 5 red flags that you should consider when choosing a hair transplant clinic. The first is not being able to meet the doctor in consultation. Many clinics have these consultants where they'll sit and they'll talk to you and they sound really knowledgeable, but at the end of the day, they're not your doctor and they're not going to be the ones responsible for your care. So what can sometimes happen is that patients show up for the day of their procedure after a consultant has basically sold them on a specific number of grafts and on the procedure, and they show up and the doctor says, oh wait, I don't think that that's possible, we can't necessarily do that. So the plan can dramatically change, or someone can all of a sudden be deemed not a candidate for surgery after they've already gone through the process of paying, carving out time in their schedule for the surgery, getting excited for it, having time for recovery. So that is really a no-go for me, in my opinion. So I think that you really ought to be able to meet with your doctor. It's okay if there's another person like a consultant, like a patient coordinator, who maybe gets the process started, but ultimately when you're signing up for surgery, you have to make sure you meet with the doctor, and not just any doctor, but a doctor who is the one who will be responsible for your actual surgery. So some clinics will have multiple doctors and you might meet with one on the day of your consultation, but then when you show up for surgery, there's a totally different doctor there to perform your procedure. And I don't think that's a good way for clinics to practice, and I don't think that patients should sign up for procedures like that. Second red flag is when there's no doctor involvement during your surgery. This is something you can at least ask about prior to signing up for surgery. Of course, you can sign up for surgery and be told that the doctor is going to be there, and then you show up for your surgery and the doctor greets you. We call them the doormen, the doctors who shake your hand, and then you never really see them again until the very end. You know, unfortunately, a lot of patients will fall into this trap where they'll sign up, they meet the doctor during the consultation, but then once they're there for surgery, they're not really getting any of the doctor's attention. Now, one thing to mention when we're talking about hair transplant surgery is that the actual surgery is a team effort. It's not like you have the doctor who is able to do every part of the surgery. And really, you don't want the doctor to do the whole surgery because you're there for like 12 hours, and that's a really long time for one person to be doing that procedure. And there are plenty of things I would worry about, certain types of fatigue. There's also, if the grafts aren't being placed back into the scalp quickly enough, they can actually be losing some of their vitality outside of the body. So you really want there to be a team for your surgery. However, you have to also expect that the doctor is going to do some aspects of the procedure, and hopefully more than just administering your local anesthesia. So for example, in my opinion, the most critical part of the hair transplant surgery is the making of recipient sites, or if someone's doing like an implant or pen technique such as DHI, you can have the surgeon actually putting the grafts in along with making the sites. But at a minimum, the site making is really the key, and that sets the stage for the entire result of the surgery. Some people ask me, well,
what about extracting the grafts?
Well, if you're doing FUT, which is the strip method, you really ought to have your surgeon, your primary doctor, do the excision of the strip and also suture that up after. If you're doing FUE, it's okay to have a team member in the clinic do the FUE as long as it's someone who has a lot of experience and is properly licensed to do that element of the surgery. It doesn't always have to be the doctor that gets every FUE graft out, as long as they have someone who's trusted on their team, who does this all the time and is able to properly extract the grafts and use good technique. But again, having no doctor involvement with your surgery other than them drawing a hairline is a no-no and should be a red flag when you're trying to choose a clinic for a hair transplant. Another red flag, number 3, is when you have a clinic that requires a minimum number of grafts. So some clinics will say, we'll only do your hair transplant if we do at least 2,500 grafts. So when you have high numbers like that, that's a required minimum, you have to be very cautious of that. You have to get get an explanation from the clinic why they think that that's the number that you require and not something much smaller. Because some patients, they're just looking for a little bit of hairline work. You can't just go into that type of procedure with the same number of grafts as a situation where someone has a Norwood 7 pattern and you're looking to really add hair to where there is no hair at all and cover a large area. So going to a clinic that requires a large number of grafts at a minimum is a huge red flag, in my opinion. You definitely want a clinic that takes a customized approach to selecting a number of grafts and doesn't necessarily pigeonhole you into especially large procedures that will exhaust a lot of your donor supply and maybe even overwhelm your recipient area and can cause problems such as tissue necrosis or just poor survivability of grafts if there's too many packed into a small area. Red flag number 4 is when during your consultation or even during the procedure or after the procedure, there's just no discussion of medical therapy. In my opinion, it ought to be at least raised as a consideration for most male patients in particular who are considering a hair transplant. There are some situations where medical therapy such as finasteride and minoxidil are not the most relevant, and those are situations where patients are older and they have lost a lot of their recipient hair, or they've had a very stable pattern for a long time. So if they haven't changed as far as the way that their hairline looks for 20 years, now they're looking for a hair transplant, odds are they're not going to all of a sudden start to recede if they're 50 plus and the pattern has been the same. So there are times when the medical therapy discussion is not the most relevant, though in most cases most men who decide to get hair transplants are in situations where medical therapy is very important. We want to preserve the existing hair before a hair transplant and after the hair transplant. And we don't want to go into a surgery when there's continuous loss of hair. When there isn't a stable foundation, that is not the time to do a hair transplant. Having this discussion with the clinic up front is very important, and I think is a marker of full transparency and the type of clinic that you want to choose when going into a hair transplant. Number 5 red flag when choosing a hair transplant clinic is having the appearance of the photos online not be consistent, or the photos that you're shown once you're there at the clinic. If there is lack of consistency between the lighting and the angle of the before and after, it becomes very difficult to tell what happened. So of course it's difficult to have consistency across every single photo that's taken in a clinic. However, you can tell that there are clinics that try a little bit harder than others to have some degree of consistency in the way that they take their photos. So you can clearly evaluate, is this the result of surgery, or is this just the result of the way that the photo was taken and the lighting and the camera that was used and the background that was used as well. So that is a very important point, because you don't want to be swayed by results that are just unrealistic. So having results that the doctor can show you that resemble the actual results of the procedure is very important. The other thing that I've seen some clinics do is that they put a lot of concealer or camouflage like powder into the person's scalp before taking the after photos. So it makes the result look a lot more impressive, but that's not accurate or honest really, because some patients think that that's just a result of the transplant itself. But no, it was also the use of camouflage. Or instead of fibers, maybe they'll put SMP, which is yet another form of camouflage, to again make the after results pop, make them look more impressive. So my message to you is, don't be led astray by that, and have a clear, level-headed mind when you're looking through all of these results, because again, you want to know what to expect when you're going into a surgery, in this case a hair transplant surgery. So if you want to learn more about hair transplant surgery, we have a lot of educational content on our channel. Check it out.